to us from the panel. Lydia is a medical doctor, she is a gender activist, a treatment activist, she's a woman of many hats, a founder of Athena, which was a tremendous privilege. She is the Africa representative for the UNAIDS PCB board, is that the correct? NGO delegation, yes, thank you. And a policy officer for TASO. So without further ado, Lydia Mongorara is going to speak about the experience of the Mamas Club. Thank you.
Sorry, you can hear me? I'm sorry, I have to speak from here because I can't go and stand there on the stand. Thank you so much, Tyler, for giving us this opportunity to come, and I really thank Dean and the group for inviting me. I think I'll start with my local work. TASO, founded in 1987, one of the first AIDS service organizations in Africa, started with going out to the community to do home-based care and sensitizing communities on how to care and look after people living with HIV/AIDS. About 10 years later, a group of positive men came out of TASO and said they're going to go out into the communities and sensitize people in the communities and look at men and talk to men and say, what are we as men doing? Now in TASO, about 70% of our clients are actually women. We've had a problem with women come up in TASO, they come for counseling, they come for treatment, and then these men got together and said, we have to go out to the community and find out what to do. So the Positive Men's Union, we call it POMU, which has been in place for quite a number of years, has been doing that work. Now, when I founded Mama's Club in 2004, I had Positive Mothers. It was a psychosocial support forum for positive mothers, training mental mothers in the community to go out and talk to other mothers. And just recently after that, a group of positive fathers came and said, the women were talking to their husband partners at home and said, trying to encourage them. And we know in PMTCT that we need both the father and the mother to come for counseling. So this group of men got together, and within Mama's Club, we now have what we call the father mentors. And they call themselves the Fathers Brigade Against HIV/AIDS. And they were came and sat together with the mothers, and we're training them on so many different aspects, especially community sensitization, because we need the community to be sensitized so that people know that men and women have to work together. And we've done a lot of work with the fathers. We've actually trained them. They're doing song and drama together. They actually have trainings together with the mothers. And I think it's been really good for us as part of MenEngage. And we at policy level, it's also very important at policy level because many of the policies we find address issues of women alone. And when recently we came up with this research with ICRW, we have a research which we're doing in Uganda on gender mainstreaming international programs. We started looking at the men involvement aspect and saying, how can we now bring in men to be part of this whole gender big topic, and say, how can men and women work together in programming, not only in PMTCT but also in other program prevention, positive prevention, in treatment, care and support, and that's what part of the work that we're doing. In research, I've also been involved in a lot of work with research. Right now, we're doing a male involvement research where we've done qualitative research in different areas in Uganda. And we've gone out in the conflict areas in the northern part of our country. There's been a conflict for about 20 years. And post-conflict, I've actually been involved in going out to these camps. We call them IDP camps. And in those camps, we've been talking to men and carrying out focus group discussions to find out what is happening. How can men and women work together? You find many of the men are in the camps sitting around as men. Then the women go out until the night and come back in the evening. There's a lot of areas where men feel that they have to be alone to do certain things, and women have to feel that they have to do things alone. And we think that we can change this pattern if we can find out what are the reasons why this is happening. And so, and in many of the policies that we're trying to do in our country, we're trying to say, let's engage men and have male involvement. In also together talk about policy research as well. We carried out last year we came out with a report on the Joint Learning Initiative on Children and HIV/AIDS. And within there, we had a learning group which was doing a learning collaborative in Rwanda on PMTCT. And we went out into the district clinics in Rwanda, and we were talking to, to different people, going to the health workers, community health workers, and the patients themselves. And we tried to find out what is it in Rwanda which is actually bringing men into PMTCT clinics. Because Rwanda is one of the countries where you have 70% of men turning up with the women. So we try to find out what can we do differently. And you find that it starts from community sensitization right in the homes. I mean, these men are mobilized in their homes, they talk to at homes. Then the community health worker plays a large role in going out into the community, mobilizing people to come for PMTCT. And you find that in the PMTCT center, they provide forums where men can engage. And this is a point I want to come to, is talking about our own health centers. We've discovered that even our health centers and our health programs do not encourage men. And you find that people say when a mother goes to deliver, it's an old habit that a man waits under the tree. That's what it used to be. And we are saying that what can we do to change it? And by finding out how Rwanda is doing this program, we're trying to do that same thing in Uganda. It takes time to change. And then who to address? People really believe in culture. And I think looking at cultural leaders, looking at our religious leaders, they're the ones who we believe can be the change agents, because they really can talk. And these cultural leaders are now, we are trying to sensitize our cultural leaders to talk to men and say, hey, this is a thing, this disease, HIV/AIDS, affects both the man and the woman. So you all have to work together. And our religious leaders are doing the same. Talking about the global, because I realized we ran out of time. On the global aspect, UNAIDS came up with this gender framework, and we, as people who are sitting on the board, we decided that we'd spread ourselves thin and bring other people in and come up with this framework, working on developing the framework. And we had 2 meetings. One was in the US, one was in Geneva. And in Geneva, after the US meeting, we brought in men and women. And it was so interesting to hear the different aspects, and you see that men are involved and really do look at the side of women. It's not about themselves only, but if we can work together, we can create a framework which can cover all genders. And then again, recently, the Global Task Team on Women, which our new Executive Director, Chelsea Dibe, came up with this Global Task Team on Women, which is going to be sitting. But the technical group we sat in Geneva again about 2 months ago, and we came up with we divided ourselves into three working groups. Now, the working group which I was working on, what can we put into national plans and strategies, and looking at national and building budgets. And it's interesting that everybody who came into each working group talked about male involvement. That what can we do to involve men? And you can see that in many countries, work has been done already. I think we just need to streamline this work and say that we as activists who have been in activism for so many years, and we started activism working together, men and women, back in about 10 years I've been doing this work in activism. We started as a group together, we didn't divide ourselves. Then ICW came up and some of us joined ICW, and it's okay to join women's groups. And then they started coming this divide, which is not very healthy, and we said, what is it that's making us divide ourselves when yet we're all fighting for the same thing? And I think what we're trying to do now is trying to mend fences now and come together and say, let's have this mending meeting. And we're now planning a meeting where we're going to have everybody coming together. We have our sexual minorities, the men, MSM, men having sex with men, women activists coming together, and we're all going to be looking at the same issues, protection, reproductive health and rights. And this is a way of joining issues together. But I believe, part of my recommendations I just want to give briefly. One of the things I think we need to start with is starting with mothers and their sons. And we think that when we're talking to our young sons, encourage the mothers right when they have their sons, not to make this divide. And the way we bring up our boys, we've been starting this thing of saying the boy is different, he's special, the girl does this and the boy does this. And we're trying to encourage at a grassroots level the mothers to look at this way of talking to their boys. Then, of course, at health center level, couple counseling. We've been trying to say, if you come for a counseling for VCT, come with your spouse.